Hello everyone. In this video, we are going to learn about development of inferior vena cava. So in the fetal life, there will be a symmetrical venous system which is present on right side and left side. So slowly what will happen in the adult, we will be having the vena cava on our right side. That is shifting of venous blood from the left to right will be happening. So understanding this concept in the development of inferior vena cava helps you to know how the congenital anomalies are happening, and it will be useful when you are facing the concept based MCQs in the development of inferior vena cava also. So in the 4th to 6th week of development, when the heart is developing, this is the sinus venosus which has a right and left horn. So in the right and left horn of sinus venosus, in the beginning there will be three veins which is draining, namely 1, 2 and 3. Okay, so the first vein is the common cardinal vein. Common cardinal vein. The second one is the umbilical vein. Third one is the vitelline vein. Okay, so these are the three veins which is draining. In the common cardinal vein, from the cranial part, anterior cardinal vein; from the caudal part, posterior cardinal vein will drain. Okay, so this anterior and posterior cardinal vein combine to form the common cardinal vein. Then apart from that, we'll be having the umbilical vein and the vitelline vein. Okay, so when the fetus grow beyond 8th week, there will be communication of these two posterior cardinal vein will happen. Okay, then further there will be appearance of one more new vein which is known as the, okay, let us consider this is the fourth vein, okay, which is known as the subcardinal vein. This subcardinal vein connects on the either side. Okay, so it connects the posterior cardinal vein cranially and caudally in the right and left side both. Okay, in the right and the left side. Further, there will be development of anastomotic vein which is connecting the two subcardinal vein. This subcardinal vein mainly drains the blood from the developing kidneys. Then there will be an anastomotic channel which will develop in between the subcardinal and the vitelline vein. Okay, so this is the right vitelline vein. So this fifth one is the anastomotic channel. Anastomotic channel between the subcardinal and right vitelline vein. Okay, so what happened? This right vitelline vein will grow further to form the right hepatocardinal channel. Okay, so this left vitelline vein and other umbilical vein will slowly regress. This right vitelline vein will develop further to form the right hepatocardinal channel. Then there will be a further development of new veins which is known as the supracardinal vein. Okay, so these are all the supracardinal vein. Okay, so the supracardinal vein will further anastomose with the previous existing subcardinal vein like this. Okay, so see the pointer. This is the anastomotic channel which develops between the supracardinal vein and the subcardinal vein. So in the adult life, most of these vein will regress. Predominantly the vein which is present on the right side will persist in the adult life to develop the inferior vena cava. Thus, in this, most of the vein in the left side will disappear. Let me show you those things. Here, see. So the vein which is persist to form the inferior vena cava will be this caudal-most part of the posterior cardinal vein on the right side, then the supracardinal vein, then the communication between the supracardinal and subcardinal, then the cranial part of the subcardinal vein, then there will be anastomotic channel between the subcardinal and the right hepatocardinal channel, which is nothing but the developed right vitelline vein. Okay, so this complete part will persist to form the adult inferior vena cava like this. So in the final part, it will be looking like this. Okay, so this region, see, this region is the right posterior cardinal vein, right supracardinal vein, anastomosis between supra and subcardinal. Okay, this is also on the right side only, everything is in the right side only. So this is the part of right subcardinal vein, then anastomotic channel between right subcardinal and vitelline vein, otherwise known as right hepatocardinal channel. This is the right hepatocardinal channel. Okay, so in this various type of question can be asked. So which part of the vein forms the proximal or distal part of the inferior vena cava? Otherwise, in the if you understand this concept, in the further video we'll see what are the congenital anomalies happening in the inferior vena cava. In that, what are the vein will persist, what are the vein will regress. Thank you for watching the video. For related embryology, histology and clinical anatomy videos, subscribe to our channel. Thank you.